Are you someone experiencing dark patchy skin over the neck? You see the pigmentation patches are increasing. People have been looking at you, telling you what's happened to your neck. It's giving you nightmares. You're upset because of this. You're someone who's done all the kinds of peels and the lasers and the ointments and moisturizers. You're doing everything, it's not working. Let's understand, how do you get rid of dark patchy skin at your neck? What is the cause? Let's work on the cause. Let's have an effective protocol and an effective remedy. We'll be discussing about certain remedies that will, show you changes from the first week itself. Let's understand dark patchy neck and effective treatment in this particular video. Namaste everyone, welcome to Jyovis Hospital of Ayurveda and Aesthetic Center, Mumbai. There are several different causes of dark patchy neck. It is not just the sunburn or the blemishes or just the pigmentation. It could be, number one, a drug-induced pigmentation. It could be lichen planus pigmentosis, which is a burning problem in today's time post-COVID. Earlier, we used to see around 5 cases in 100 patients, and now almost 42 patients where the face, neck, it's becoming dark and purple, slight purple in color, grey in color. The third, there is ashy dermatosis, where everything forms like an ash color. The grey scale, the grey ash form patches. Symptoms are same like the LPP, the lichen planus pigmentosis, but LPP is purple and here it's grey ash-like color. The other condition which we commonly see is the Acanthosis nigricans. Due to hormonal imbalance, or we see kind of patients who've reduced their weight immediately, they have all these kinds of thick scale and with dark discoloration. Another condition we see, dermatitis neglecta. So all these conditions where the neck starts getting discolored, these have different symptoms. Some have patchy skin, some have the dark discoloration, some are purple, some are ash color. It's very important to diagnose the cause over here. Ayurveda is a science that provides 10 on 10 results for such conditions. It's very important to find out the cause. Now LPP, we know lichen planus drug eruption. If we search about the drugs, there's a list of drugs we get on the internet as well for a common man. They can go through and they can see that these are the ingredients that is directly responsible to the LPP. People apply the hair color which has PPD and ammonia directly related to hair, the patchy skin. We see ashy dermatosis and another autoimmune condition. We see autoimmune skin disorders where patients, because of the stress, we see discoloration. So for all these patients, it's very important to firstly understand the cause and then have an effective treatment. For understanding a cause, it's very important to consult an authentic classical Ayurvedic doctor and understand the depth of the condition. Of course, after you're done with all the peels, which are very effective, but 90% people often say that they're not responding. They've done the glycolic peels, the lactic acid peels, the IPL lasers, the yellow peel, which is a retinol peel, a lot of koji glow, kojic acid, retinols, a lot of skin lightening treatments and ingredients and creams and lotions and moisturizers, but patient finds minimal to no change. Here's what I want to tell you in this video: work on the cause. Understand what the cause is and then have a treatment accordingly. In this video, I'm going to share about the effective external applications. If nothing has worked, you'll definitely see a change with this kind of a protocol about which I'm going to discuss in this video. I'll be sharing about 3 effective remedies and home treatments that you must definitely consider doing. Number 1, it's very important that we have a combination of 2 ingredients which come from the Varaniya Mahakashaya explained by Lord Charak. Varaniya Mahakashaya has 10 ingredients. Some of them are not available. I'm talking about the ones that are commonly available in every part of the world today. This is Indian Sarsaparilla Sariva. This is Yashti Madhu, also known as Jeshti Mad. A common medicine you'll get worldwide. Simply mix them 2 in equal amount, make a paste and apply this paste all over the discolored areas. Keep it for 30-45 minutes, wash it off. It's always better if you mix it, and if you have a lap instead of water, you can apply, you can mix milk. You can mix raw milk, apply a paste, wash it off. Number 1 is lap. Number two, very effective medicine and a treatment that definitely works for each and every single person. We have Yashti Madhu, we have Sariva. Over here you can add another one which is Vacha. Vacha, which is vacant Vacha Churna. So over here, mix these two or mix this two and do a Shashtika Shali Pinda Swet. Do a potli. Do a potli where you need grated coconut, you need turmeric, you need the Shashtika rice, which is red rice, or the white rice, which is also called as the Shali rice, Navra Khizi rice. You use the red rice or use white rice, which you have at home. Make a potli. Anyone in the world today has these ingredients, so you can make a potli of that, and simply you do a potli of this particular medicine at the affected area. I have an entire video explaining how to do the potli. I will put that video link in the description, so you go through that. You can type on YouTube Jyovis pigmentation or Jyovis lichen planus or Jyovis potli. You will get that video very easily, and I really advise that you must do it, and patients tell us that from the first week itself they are seeing a lot of change. The third very effective one is a combination of 3 fruits, which is Avala, Bhibitaki and Haritaki. This is nothing other than Triphala. You take Triphala and you add half to 1 teaspoon of turmeric, which is haldi. You mix this well. If you want, or if more areas are affected, you can add besan into it. You mix this, and while you're bathing, you put water all over your body and just do a udvartan, do a rubbing of this medicine at the affected area. You can mix it with buttermilk or raw cow's milk. You can mix it with buttermilk or cow's milk, anyone, and do a udvartan. It is beautifully explained as such lesions are because of a vat and cough. Beautifully explained as udvartanam kafaharam medasya pravilapanam. Medasya pravilapanam. So this will have a varnya action, a skin enhancing, skin complexion enhancing action, at the same time lekhan action. Lekhan, which means have a scraping effect. So it will scrape the agents that are not required, at the same time have a skin complexion enhancing effect. So Varnya and Lekhan action beautifully seen by Triphala Haldi Besan Udvartanam over the affected area. So this is very effective medicine. There are a lot of other treatments, right from Raktamokshan to Nasya, Nasahi Shirisodwaram. Work on the Nasya for all Urdhva Jatrugat Vyadi, all disorders above the clavicle, Nasya. So we do a Keshar Gogrut Nasya or a Kumkumadi Tel Nasya for such conditions. You can apply a Kumkumadi Lepam capsule or a Kumkumadi Lepam cream or a Kumkumadi Lep, Kumkumadi Grit or the Keshar Kumkum Grita or Kumkumadi Grita or Taila at the affected area once or twice a day. These 3 effective treatments, Kumkum, effective one, Nasya with Kumkumadi Tel or Kumkumadi Grita, a effective medicine for having a skin complexion enhancing treatment, at the same time a Lekhan Karya, scraping effects is very important. So it's not just about a Varnya Karya, Lekhan and Varnya, both things are the principles that we've applied over here in this particular video. So make sure you follow them, write down your views in the comment section below. I'd be very happy to hear out from you. Share this video further with those whom you have seen or you've told them that why are these lesions there over your neck. Share this video to them, give them the happiness that they really need, and write down your views in the comment section below. Until next time, from Jyovis and the team, look impressive, be progressive.